To daybreak, it's now 9 minutes past 7 o'clock. We have still more to talk about this morning, including the situation with the coronavirus, and later on we'll be speaking about the situation with TB, because today is the World TB Day, and there's a lot of discussion around TB and COVID-19. We'll be looking at the relationship on that. But first, we speak to Dr. Ngoy Nsenga, who is a team leader with the World Health Organization in the region of East and Southern Africa. Dr. Ngoy Nsenga was with us last week. We were talking about the situation then. We had about 300 cases in Africa, but now we are talking about more than 1,200 cases. And Dr. Nsenga, good morning, first of all. Of course, you're speaking to us from Nairobi. When you look at the numbers, last week, in just 7 days, we have seen the increase in cases in Africa from about 300 to now 1,200 and more and counting. What comes to your mind when you look at these numbers? Is it that we are better now at testing, or is it that we have received more infections? What can you describe this situation as?
Okay, thank you very much, Sam, and good morning, and thank you again for having me. Yes, as we were saying last week, I think the outbreak is moving very quickly and very fast in our region. You remember last week we were talking about 7 countries that were affected in East and Southern Africa, but we have more than 50 countries affected. So that's in addition to the number of people who have been detected as being affected. Mm-hmm. So now, what is the dynamic here? There are two aspects to that. One is, yes, because of the measure that we've put in place, there are those who were contact and those who now turn positive. That's one reason. Mm-hmm. Two, we are testing. But that said, we should be clear that this shows that the outbreak is taking root in our countries. And we are having, in some countries already, some.
All right, unfortunately having challenges hearing Dr. Ngoy Nsenga. We'll try to reach him using a different technology so that he can speak to us about what we are now experiencing here, not just in Nairobi, but also in the region of East and Southern Africa. We'll be trying to reach him on phone just to continue that conversation. But first, let's take a look at what the Cabinet Secretary in charge of Health Affairs said yesterday, specifically on what you need to do. Let's begin with the cancellation of flights and whatever has happened, because we understand that by tomorrow midnight, that is, I should think it's actually midnight tonight. It's because that now crosses over to 25th of March, that is Wednesday. He said that the international flights will be cancelled. This is what he said yesterday in regards to that.
All flights effective midnight, 25th March 2020, international flights, as one of the key measures to prevent importation of additional cases in the country. Let me reiterate that all passengers coming into the country between now and that day, Wednesday, midnight, must undergo mandatory quarantine, either A, at their own expense in hotels, in government-approved hotels, or in designated government facilities. I want at this point to issue an apology from the Ministry of Health and other government agencies that are involved in this exercise to the parents and the individuals who have been so inconvenienced since last night. We are aware that we had logistical challenges that we encountered as a result of the speed at which we wanted to move into quarantining individuals. And therefore we know that we inconvenienced people substantially. And for this, we can only apologize and mitigate by saying it was absolutely necessary that we do so.
All right, so that's the Cabinet Secretary in charge of health, and he also spoke about the situation with hotels, bearing in mind that for those Kenyans that have been returning to the country, as well as people with foreigners with permanent residence or residence permit, they have been coming to the country, and there is a plot that to have them quarantined. So he was speaking to hotels that have been overcharging or charging exorbitant fees. Let's listen to what he said.
I also want to thank those hotels that have already admitted the quarantined people, but to make also a passionate appeal. In a manner of speaking, business has been brought to you by steroids. We are appealing to you. These are people who came into the country without a plan to spend money in a hotel. If your normal charges in a hotel room are 12,000 shillings, you should be charging no more than 50% of that, or even 25% of that. This is business you didn't expect, and you are not going to get it. So to expect a person who had no plans of spending time in a hotel to spend or to pay the rates that you normally charge anybody else is again immoral and inconsiderate. So we are asking you, the hotels that have offered themselves for this purpose, to also charge reasonably, reduce the rate as part of your corporate social responsibility. It would help Kenyans.
All right, so Cabinet Secretary in charge of health, Mutahi Kagwe. Now let's get back to speaking to Dr. Ngoy Nsenga, who is the team leader with the World Health Organization in the Eastern Southern Africa region that he has been steering. And Dr. Ngoy Nsenga, before we went offline, we were speaking about the situation in Africa, and you were telling us that the testing now is yielding more results. Just clarify that, because we're not able to hear you clearly on, excuse me, on what this should mean for Africa in the coming days and weeks.
Thank you, Sam, and again, thank you for having me. Yes, I was saying the increase in number, there are several reasons to that. On one side, yes, because of the measures that countries are putting in place, and WHO is supporting countries on that, and as well as other partners, because we are following up the contacts. Remember last week we were saying one of the key measures to combat the outbreak is to follow each one of the contacts or the person that has been in contact with an infected person or the person who got the disease. So because we are following up the contacts, it's much easier to detect once they start having signs and symptoms and to test them. That's one of the reasons. The second reason is obviously, yes, we are testing more, then therefore we are getting more cases. But there is another reason, which is to us, a kind of concern is obviously in some countries we are already having some of local transmission. That is the number of people who get infected within the country not being imported, what we call imported case, is also increasing. That is of concern. So those are the reasons why we are seeing this number. That's why on one side, yes, we can be a little bit surprised because we are detecting, but we are detecting because we are having some local transmission. That's of concern, and countries should continue making that effort to detect, to isolate, and to treat.
All right. And yes, Dr. Ngoy, we're waking up to the news of a priest who traveled from Rome and came into the country. He was asked to self-quarantine, but that did not necessarily happen. We understand that he has made several tours. I mean, what is the gap that you, from where you sit, you are assessing and seeing that should mean a person is asked to self-quarantine, but that is not adhered to? What could be the challenge in passing this information?
Okay, obviously I'm not going to talk about the specific case because I don't have much information about the case you're talking about. But in general, as you say again last week, is one of the measures to really combat this outbreak is to put in place a strong surveillance system. A strong surveillance system that starts from the point of entry, of course, but also within the country. And that's one. Two, we need to follow up to make in place measures so that those who are suspected to be infected, who respond to the case of being in contact if someone was infected, we need to follow up for at least 14 days. That's the second measure, which is very, very important. Now, isolation, we understand that human being is a social creature. He always wants to socialize with others. So isolation and quarantine is challenge to anybody put in that condition. So that's why, as a WHO, our guideline is providing the way of trying to ease the psychosocial trauma, if you can call it, on those who are being put in quarantine and those who are being put in self-isolation.
And from what you know, Dr. of course, there are the sensitivities that you don't want to stigmatize those persons that are suspected to be infected with the virus. But then again, how is that communication supposed to happen? Because we hear from the government that they are tracing 550 contacts. But then again, if you do not know the primary cause why you're being looked for, how are you supposed to even volunteer yourself? How are you supposed to even protect yourself, including self-quarantine yourself? What are supposed to be the protocols in dealing with such situations?
No, I think in this situation, or like any other situation, the outbreak is not. Remember, last week we were talking about community engagement. We need to win over the population to the measure we are putting in place if we're expecting them to adhere to all those measures. That's the key. And I think my colleague in the field and all countries, they are really doing their best to communicate properly, to communicate in transparency with not only the people who are suspected to have been infected, but all the population, so that they understand why these measures are being put in place. So contact, of course, the health workers, those who are following up the contact, they are discussing with them, they are telling them, they are kind of sensitizing them why you need to be followed up for that long period, why you need to be in quarantine for that period. These are the messages that is being passed by the colleagues who are really working hard in the field, and really we need to recognize the work they've been doing so far.
And so therefore the question, Dr. So let's say that a resident in Siaya County may have attended the funeral that was presided over by a Catholic priest there. They might not have the information. What is supposed to happen so that they know they need to be wary about a certain thing?
Okay, again, I'm not talking about specific cases, but in general, according to the guideline that we've shared with countries, yes, you might not be aware that you have been in contact with, let's say, someone traveled in an airplane with someone who was sick. Then the national authority, they find out this plane carried a person who was infected. Therefore, we need to locate all those who traveled together there. You might not know at that point that you travel with someone who was already infected. And then once they get touch with you, they will explain. It's not a police service. It is a public health service. So they will explain why they've been trying to reach you and why you need to take some of the measures.
Yes, and Dr. So we are coming to a situation where the cases are rising each and every day. We are reporting in Rwanda, we are seeing a spike from the cases they had. It has gone up by 17 to reach 36. We're looking at Uganda now has 8 more cases to stand at 9. Kenya has 16 cases. South Africa has more than 400 now. There is the temptation to lose hope, because if you look at the narratives like in Italy, if you look at South Korea, the European countries, it started like this and eventually it blew out, and there are so many cases right now they're not able to deal with them. How do you keep the peace? How do you keep the faith and the hope so that you're not so that you don't lose hope as you continue to attempt to contain the spread?
Thank you, Sam. I think let me quote here as Churchill who says, the only thing we need to fear is the fear itself. I really plead not only with you, Sam, but all our listeners and TV watchers and the public in general. We should not lose hope, because this is the word you use. We should not use hope. Instead,
This should show us that we need to make even more effort individually. First of all, every one of us has to understand that now, if we're taking it lightly, we have to take it serious. It's not a problem of national authorities or CS alone or ministers alone. It's everyone's business. Everyone has to protect his family, to protect your neighbor, to protect your town, to protect your country, and to protect the world. It's everyone's business. We have to understand that. Now, coming to what you're comparing between countries, every country has its own context, and the response to the outbreak has to take into account that context, including the social context, including the health system context. Countries, I'm telling colleagues, money is everything. We agree money is needed, but money is not everything. It's not because you have resources that necessarily the response could be adequate. We need to take into account, even in Africa, our own social context, our own social behavior, and put that in the equation where if we want really to address the issue of the outbreak. The increasing number, yes, is of concern, but this is just showing us and needing us to put more effort there, everyone wherever he is or wherever she is right now.
Okay, of course, Daktari, yes, we are where we are now. There are so many measures that have been put in place. We saw a situation in Eldoret of people being asked to step out of the town. And this is repeated in different parts of the region that you represent. For how long do you think we can be in this situation? For South Africa, they have said for 3 weeks it will be on lockdown. How long can you sustain this?
Yeah, I agree. It's a challenge, but this is a challenge that everyone, as a citizen, as a citizen of the world, we are called to respond to. Look, we need to learn from the bad lesson. We need to learn from the good lesson. When we look around the world, countries that manage to stop, if I can put that word, the outbreak in relatively adequate time. What did they put in place? What did they use in terms of what their capacity, their own capacity, internal, social, cultural capacity? What did they use? And those who today, their outbreak is going almost, in a huge number. Then we need also to learn what went wrong. So that, again, we need to apply each one of us, not only the government. I'm really insisting on this. Each one of us, we need to adhere to the measure we are being told about, how to prevent the disease from first yourself, and also preventing that in case you are infected, you transmit that disease to others. That's very important.
All right, and Dr. as you look at, you come from the WHO, and 2 weeks ago, I believe, if I'm not mistaken, this disease was declared a global pandemic. Do you think we've made progress over the past 2 weeks? And I know the sponsorship, the donor funding has gone up in terms of the contributions that have been coming in. But do you think the world is responding better to this after it was declared a pandemic?
Our Director General said it. The calling of the outbreak as a pandemic was not going to change the way WHO was acting. And it did not change the way WHO is acting in terms of supporting countries. And we are expecting countries also not to end, but just to reinforce in their effort to stop the disease from spreading. Now, let me come a little bit to the question you're asking about the delay. The delay, what time can we expect, and how am I foreseeing this? The time will depend not only with which each country is doing in terms of trying to prevent the disease from spreading further. It will depend, of course, within the country, each individual that is taking to try to prevent the disease from spreading further. That will be how long are we going to deal with this disease.
And Dr. yes, I don't know whether Zimbabwe within your region, I know it's in the South African part of the continent, but I don't know whether it's in your specific region. But yesterday we saw the first death from COVID-19. It's a young man who is 30 years old, a journalist. But you also know that they have a bed capacity of about 35 to take care of this. what do you think can be done at this situation to, of course, prepare adequately and help the lives of those people that may be infected by the virus?
Yes, especially Zimbabwe is in southern region, or is in the region I'm covering. Yes, all the measures that WHO has been advising countries and the individuals to put in place to fight the disease, all the measures still apply. When you don't have cases, what do you need to do? When you start having some class of cases, that is a few number of cases, what do you need to do? And when you are having local transmission, community transmission, what do you need to do? As a country, we need, African countries, we need to recognize our capacity, but also our limitations. You know, most of the cases that are passing away, unfortunately, we are losing cases. They are severe and very critical cases. And those cases, they need sometimes very intensive care in terms of treatment. So as the African countries, what capacity do we have to handle a huge number of patients in critical care? I think most of our countries, they don't, at least at this point, they cannot cover that huge number. That's why we need to act now. Yes, we are having already cases, but we need to act, and to act even further, even to act even stronger than we have been doing so far. I mean, that's my appeal, not only to countries, but my appeal to individuals, or all of us, to take this issue now seriously.
Right, Dr. Ngoy Nsenga, the team leader for the World Health Organization in East and Southern Africa. Thank you so much for making time for us to reflect on some of those matters that we've been talking about. Of course, we continue with the coverage of the COVID-19. We're reaching a situation where it's starting to get alarming in Africa, but also there are certain things that you need to do individually, including washing your hands, keeping safe distance, at least a meter, avoiding a lot of congestion like we are doing here at Citizen TV. I don't know whether we have the big camera that could show us this, but also trying as much as possible to cooperate with authorities. I know that there's a call by the national government officials in Siaya County asking those people that may have attended the funeral in Ugunja to volunteer themselves to self-quarantine. And of course, also there's the communication that all persons that are returning to the country to make sure that they elect to self-quarantine, but also should they not do so, then the government is going to do what they're saying, they're calling forceful quarantine. So we will be taking a short break. When we return, we'll continue with some of these matters, including speaking to Dr. Philip Owiti, who is a technical advisor with the National TB program, that is tuberculosis program. Today is the World TB Day. We'll be looking at the progress that has been made in Kenya in fighting this infectious disease that is also